Hello everyone, this is Anshika Agrawal and today I am going to teach you about leukoedema, which is a topic from oral medicine and radiology from the developmental disturbances. So beginning with introduction, it is a common alteration of the oral mucosa which appears as a diffuse grayish white opalescent area on the oral mucosa. So it is a very common alternation of the oral mucosa, which means it is a change in the anatomy of the oral mucosa. It is a kind of benign condition, and clinically it can be seen as a diffused form, or it can be seen in patches in grayish white opalescent areas in the oral cavity. Then etiology. It is believed that the intercellular edema of the superficial epithelial cells and the parakeratinized epithelium produces the typical grayish white appearance in this condition. So, histopathologically, these parakeratinized epithelium and the edema in the intercellular layer of the superficial epithelial cells is responsible for producing this grayish white appearance in the oral cavity. It is seen more significantly in individuals with any form of tobacco habit. So people who consume tobacco are most commonly seen with this condition. And smoking does not cause leukoedema, but it may aggravate it. So what are the clinical features? So first, it is asymptomatic. It does not produce any symptoms. Clinically, it can be seen as a grayish white diffuse opalescent region and most commonly found on the buccal mucosa. Then other regions it may include are the floor of the mouth and the soft palate. Then second, it is more commonly found in the black people or in the darker people as compared to the fairer people. Then third, if you stretch the areas, these opalescent areas with diffuse grayish white discoloration, if you stretch them, then this discoloration or this opalescent region disappears on stretching. So this technique is called as stretch test, and it is a characteristic feature of the leukoedema. It helps to differentiate leukoedema from leukoplakia and various other white lesions of the oral cavity. Then it is more commonly found in males. Now histopathology and ultrastructural features. So as I told you, intracellular edema within the spinous layer is a characteristic feature in leukoedema. So there is intracellular edema in the spinous layer of the epithelium that is responsible for leukoedema. So why does this edema occur? It occurs due to the vacuolation in the cytoplasm of the cells. They have the large pycnotic nuclei. So these cytoplasm of the cells with vacuolation and large pycnotic nuclei are responsible for the intracellular edema. Then as we see, towards the surface of the epithelium, the vacuolated cells collapse into a compact layer of flattened cells, and the outer layer of cells swell again to form the characteristic superficial layer of ballooning cells of leukoedema. So the superficial layer, which was previously swollen, that layer collapsed into a compact layer of flattened cells. So first it was swollen, then it got compact, it collapsed, and then the layer which is outer to these compact cells, now that layer starts ballooning, and that superficial layer is ballooning, contains ballooning cells of leukoedema. Then why is there vacuolation of the cytoplasm? So vacuolation is caused because of reduced mitochondrial function. The superficial ballooning cells which we see are none other than the degenerated cells. So presence of a compact layer of vacuolated cells, keratohyalin granules, keratohyalin like structures in the so these are all the things we see in the superficial layer of the cells. What do we see? Vacuolated cells, keratohyalin granules, and keratohyalin like structures. These are none other than the aborted form of keratinization. So they are responsible for the keratinization of the superficial layer of the cells, but other than keratinizing, they are aborted. Like they were meant to function to keratinize, but now they are aborted, and now they are a layer of the degenerated cells. So in this diagram, as you can see, this first diagram, there is basal layer, and then in the spinous layer you can see there is intracellular edema, then there is granular layer, and upper than that there is parakeratin layer. Same in the other diagram, you can see there is thickened undulating surface, then there is hyalinization, and between them there is intracellular edema. So what is the treatment? So there is no necessary treatment, as it is not a malignant condition, it is a benign condition, and it is asymptomatic, and the ETO is also like multifactorial, it is not known. So it is believed that cessation of the tobacco habit leads to the less prominency of this condition. So thank you guys.